Hi everyone, Dr. Mark here again. Just thought I'd give you some tips to help you out. Sometimes we land in trouble and we have nowhere to turn. So I'm here to help you in a dental fashion to just give you some tips to see what we can do. We do this every day. We triage people in pain who've got a lot of problems, and I'd like to just to help you in case you're out in the middle of nowhere and don't have any help, but you do have internet coverage. So people have an ache in their tooth or ache in their gum, something's hurting, the jaw's hurting. The first thing to do is actually try and avoid this sore area. Try not to stimulate it with anything hot, with anything cold. If it's sore, with it's biting, please leave it alone. Don't bite it, just avoid it. Now, most people do that, some people don't, so I'm just telling you, just be careful. Just don't stimulate it in any way. Leave it alone. Second thing you could do is, if it's round, use saltwater rinses to rinse in that area gently to allow that salt, and do it for a minute. Half a teaspoon of salt in a glass of warm water for 1 minute. Just allow that to sit around the area, especially if it's inflamed or swollen. First thing is, if you can brush gently, sometimes it's sore because you haven't cleaned it well. And so if you can just brush gently around that area, if it's not too painful, or floss gently around it, that would be really good. Four things, things break off in people's mouths and they lacerate their tongue and it gets very sore. So if you can't get to it straight away, choose some sugarless gum, not any gum with sugar in it. And then wrap that up, stick it on the tooth in the area and just cover it so it doesn't lacerate your gum. Fourth thing is pain relief. Painkillers are great, especially when you need them. Sometimes you can combine Nurofen and Panadol together. That's if you're not allergic to anything like that. So that 1 + 1 for the Nurofen and Panadol equals 3. It's quite effective as a pain relief and helps you. Last result, if it's really sore, you can go to the GP if we're not available, and some antibiotics as a last resort if something feels like it's swollen. And sixth thing is to visit us as soon as possible. Sometimes these things come and then they go, and people think, oh, the pain's gone away, everything must be okay. And most things in people's mouths occur without pain. Most people lose teeth without pain. I know it's weird, but they do. So just because the pain is gone, it doesn't mean everything's okay now. So please visit us as soon as you can. All right, just tips from me. Have a great day. Thank you.